and then I will hand across to you. Oh, Jackie's already started the recording. Thanks, Jackie. She's on it. Fabulous. So I'll hand across to you, Catherine. Thank you.
Brilliant. Thank you for that introduction, Jessie. Yeah, so my name's Catherine. I'm an OT working in East London currently, but I'm going to be putting my student hat back on for this presentation to discuss the Planetary Health Report Card, or the PHRC, and what this looks like for AHPs and sort of the growth we're seeing in this area for AHPs. So we'll cover a few things in the course of this presentation. Firstly, I'll be discussing what planetary health is, and then going on to explain what this tool, the PHRC, is. And then having a bit of a think about what this means for AHPs going forward. And then, like Jessie said, I'll be joined by Ka Yan to share a bit of her experience, and then we'll round off with sort of a Q&A panel. So if you have any questions, please do keep them in mind during the course of this presentation. We'd love to hear them at the end. So first things first, planetary health, and what is this term? If you've chosen to come to a Greener AHP Week presentation, you may already be familiar with this term or with similar terms. Often it's used interchangeably with things like sustainable healthcare. And while these two ideas are often thinking about pretty similar things about health in the context of the climate crisis, and they're trying to answer pretty similar questions, there's sort of a slight distinction between them, where sustainable healthcare is kind of thinking about how we can adapt and develop healthcare services to not just not contribute to the climate crisis, but actually be able to respond to the challenges that climate change poses to health. The planetary health sort of idea is a bit more conceptual. It starts off with an acknowledgement that human action is really sort of at the core behind why we see these changes happening in our planet. And these changes often have a variety of negative effects for health in a general sense. So it's really expanding this idea of health beyond just human health, but to the health of other animal and plant species, but also to sort of the natural workings of systems on our planet. And the idea underlying this is that if we're concerned with human health, which as healthcare clinicians and students we probably are, we need to be concerned about the health of the planet, because the two are really intricately linked and reliant on each other. So that's kind of what planetary health is. And like I've said, we as clinicians probably have an interest in this, or as future clinicians. But what's sort of the current state of play in terms of AHP interest? So I've taken a slightly biased example, I'll admit, for this, from a sustainability survey from the Royal College of Occupational Therapists. So this was done last year, and of the sort of 1,000 or 2,000 OTs surveyed, 95% of them felt that they had a role to play in their clinical work in promoting sustainability. That's a really clear majority. However, we see this number sort of pretty significantly plummet then when these same OTs were asked about sort of how able they felt to take action to actually practice sustainably. And then this number drops a bit further again when these OTs were asked about their confidence to influence other health and social care professionals to, again, practice sustainably. So we see a bit of a discrepancy here between wanting to sort of think about sustainability in our clinical work and then an ability to do so. So there's desire and ability, there's a missing link there. And I think for me, at least, this link is based on a lack of knowledge and a lack of skills, where do we most commonly get those? We get them in our training, often in sort of the capacity of our universities. And this leads me to the PHRC. So the Planetary Health Report Card, before we can sort of think about, well, what skills do we want to teach? What knowledge do we want to give our future AHP and healthcare students? We need to think about, well, what's the current state of play? Is planetary health being featured in education at all? And that's kind of one of the purposes of this tool. So this is a tool that's been designed by students, originally medical students in the US. It's now sort of gone further afield into different disciplines. And this is a tool that's then carried out in student teams at individual departments within individual universities. And it's made up of about 60 to 70 metrics or questions. and they come in a sort of a standardised format. So there'll be a standardised sort of medical planetary health report card, a standardised nursing one, pharmacy one, physio one, etc. for the different disciplines that currently have a PHRC. And so the student team who is completing this report card for their particular university will look at the educational experiences of them and their fellow students within their discipline over the past 12 months. And the purpose of this is to see, firstly, what's going well in regards to planetary health, what kind of things and practices are their department doing that sort of promote planetary health, but also pinpoint sort of what are areas for growth and development going forwards. And the hope then is that in a year's time, this report card will then be repeated, and then those things that were sort of picked up on, that were sort of areas for development or called sort of recommendations that universities can pick up on, have been sort of somewhat worked on over those past 12 months, and that will improve the outcome of this report card. So it's broken down into 5 different sections. So we see 5 different symbols here. And this is basically a way for, even though different disciplines will have slightly different report cards, they'll all follow the format of touching on these 5 different sections. So the first one is the curriculum. So this little blue pencil here, and that's probably the largest and the most significant area. And that's interested in what's being taught in a sort of a more formal sort of lecture seminar setting. Are we being taught about how particular conditions are impacted by climate change? Could that be sort of cardiovascular or mental health, for instance? But also ask questions about, are we being taught particular skills, say to take environmental histories or to think about quality improvement within the context of environmental sustainability? The second section then is this sort of green microscope, and that's all about research and whether faculty members in your school are involved in any kind of planetary research and sort of developing that, and if sort of possibly if they're sort of involved in seminars or conferences being hosted through your university or your department that either feature or focus on planetary health. The third section then is community outreach and advocacy, and the metrics here are interested in the affiliations that your department might have with local organisations, charities, but also the university hospital, and whether any of these feature planetary health either in the interventions they're offering or, say, for instance, at the affiliated university hospital. Is there any kind of reference about sustainability on student placements or also in preceptorship programs following graduation? The fourth section then is student-led initiatives, and this is interested in whether students have the opportunity to sort of more autonomously get involved in projects about planetary health. That could be through societies, sort of discussing planetary health or focusing on it, or it also could be, say, through research or fellowship opportunities. And the fifth and final section, this little green hand, is about campus-wide sustainability. So this is beyond just your university department. Say, for instance, the University of East Anglia's occupational therapy department, which is sort of the one that I was working within. So it's looking beyond that department at sort of your university as a whole to see how sustainability is sort of featured. And the questions here are very broad. It's everything from plant-based options being featured in your cafeterias to the design and infrastructure of buildings to how what are the energy sources at your university. So it's really diverse, and students are encouraged to collaborate with other teams within their university who are also doing a planetary health report card. So say, for instance, at the University of East Anglia, there was a medicine team also doing a report card. So I worked a bit with them. So we produced separate report cards, but because obviously our campus is the same, we would, in theory, come to the same conclusions about campus-wide sustainability. So that's kind of what the PHRC is in theory, but I think it's helpful to sort of bring this to life a bit and show you what this looks like. So we can see that each of the 5 sections here receive a grade, and that grade is calculated according to the number of points given via the metrics, and then an overall grade through the total number of points is produced at the end. So this is from the physiotherapy report card, which was done last year, which was the first AHP PHRC produced. And here we see that each of the 5 sections also gets a summary. Firstly, to say what's going well, but then also we see this recommendation section. So this is kind of what I mentioned earlier about having sort of quite clear points for development or action points, and it can just be 1 or 2 per section. It's about making it realistic, but also quite specialised and specific to the department that you've been sort of looking at during this report card. And then I've also got a snapshot of one of the metrics just to show you what this looks like, so we can see that there's a number of different points available for each metric. The one chosen for is sort of highlighted in green, and then beneath in italics, the student team completing the report card has to sort of give a justification for why they've awarded the number of points they have. This could be through citing evidence like the particular module or lecture, but also maybe saying why it wasn't awarded full points. So that's what it looks like in practice. A bit of, where this has come from. So like I sort of mentioned, it was started in the US at just a couple of medical schools, and not that long ago in 2019, but has quickly and fairly rapidly sort of grown from just a couple of medical schools. So there's quite a few more schools involved just beyond the USA, but also sort of all around the globe. We can see obviously in the UK, but also places like Malaysia and Germany and Japan. And then also in more recent years, there's been a greater interest from other healthcare disciplines. So there's a nursing report card now. There's also a dentistry one, a veterinary science one. So it continues to grow as time goes on. And the hope is that this is something that's done on an annual basis. So the recommendations given can be built on, and the idea then is that in theory the overall grades should increase because there's more of a culture of sort of teaching planetary health. And you might look at these mean scores and think that's not a lot of increase at all, but just to sort of draw your attention to the bottom, that we can see the number of institutions grows pretty steadily each year, which is really exciting. And I think there was sort of 158 institutions involved this year. But with new institutions and new schools, the understanding is generally the first time you complete a report card is you'll probably get a lower score because you don't have those previous recommendations to be building off of. So then when we look at returning institutions, they're sort of a fairly sort of consistent higher level number that sort of are increasing their score. And I think this year, 78% of returning institutions improved their score. So that kind of gives us confidence that it is kind of developing the sort of a practice of teaching planetary health. It's also important to note that so this is done annually, and the results are always published on Earth Day. So just on Monday gone, the 2024 report cards went live. So I'd really invite you to take a look at the PHRC website after this, if any of you are interested. So bringing this back to AHPs then, and sort of why is this of interest to us? I've touched on at the start that if you're sort of working in healthcare and with human health, planetary health is probably going to be something that's important to you because they're so sort of interwoven. But why AHPs specifically? So there's a pretty sizable number of us. This is a slightly dated stat from 2018, but then there was sort of 170,000 sort of roughly, they estimate, sort of AHPs in the NHS alone. So that's before we think about private practice and obviously in a global sense. And of course, the PHRC is a global network of students. So we're thinking about how this could sort of support AHPs sort of really around the world to develop a culture of teaching planetary health. And so with a sizable number of people and the kind of the people power sort of potential there's a promise of real impact if more of us are skilled up and have the knowledge and language to think about planetary health and solving planetary health problems. But more than just having a sheer number of us, we're also really well placed within healthcare services. Some of us work in areas where there's sort of the highest carbon emissions, for instance, areas like acute care. And therefore, those who are sort of working in those kinds of settings are really well placed to think about, well, what are ways that we could adjust things and change things? And you also kind of, by being in those settings, you know what's viable, what is actually a realistic change you can make. But you need sort of the planetary health knowledge and skills in order to be aware of that and think about making those changes. And then third and finally, while this doesn't go for all AHPs, a significant number of AHPs offer interventions and sort of health solutions that are kind of naturally very in keeping with the principles of sustainable healthcare, such as prevention, patient empowerment, and sort of low carbon alternatives. And therefore, we're sort of ready and waiting in the wings to sort of bring those sustainable solutions. But again, we come back to this question of, well, do we have the means and the ability to sort of take advantage of the people power, being well placed, and having sort of the right training to practice sustainably? So this brings me to a bit of my own experience. So I sort of mentioned already that there's sort of been a growth in the number of disciplines involved in the PHRC network. And this year it's very exciting. There was the first occupational therapy one. So I'll share a bit of my experience. So I was involved in the sort of the co-designing of the OT template. So that's kind of the standardized set of metrics that in theory can be used sort of around the world in future years. So I was involved in the design of that, and then I went on to be part of the pilot of it at my university. So I got involved in this because I heard about it through different sustainability avenues I was part of. So I was volunteering for the Centre for Sustainable Healthcare while a student, and I kept hearing about this PHRC thing, and so I decided to investigate, and I thought it was really interesting. And the physiotherapy one had just been sort of gone live on their website, and I thought, oh, that's really great, but I saw there was no OT one, so I kind of felt like there was a bit of a gap that possibly I could fill in some capacity. So I reached out to the leadership team just sort of via their email on the website, and they were absolutely delighted, and they said, we actually have an OT educator who's interested in designing one of these too, and so cue Ka Yan. So we went on to design it, and Ka Yan sort of gathered this team of OT students, and then sort of collectively we sort of designed this template and showed it to some other OT lecturers as well to get their feedback. And then I went on to then sort of run the pilot of it at my university. So that involved speaking to my lecturers about it, speaking to other students I knew about it. I presented at my sort of occupational therapy society at my university to sort of spread the word. And then I went on, I sort of gathered a team of students. And yes, we filled out all the metrics, and all our sort of hard work has sort of come to fruition, and things have gone live and are on the website now. So that's been a really exciting experience, and definitely been a good way to learn a lot about planetary health. So I'm aware that sort of various ones of you watching this, some of you might be students or educators, but quite a lot of you will probably be clinicians. So while this might be interesting to you, you might kind of think, well, what's kind of the relevance in some ways, but whether you're kind of out of formal education, you might still have educational opportunities, you might still know students, know educators, and I also think there's a lot of scope for thinking about how can planetary health and planetary health education come into sort of our educational opportunities following university as well. Definitely since having started to work, I know that there's a lot of education and sort of seminars and opportunities once you're in working life as well, so that learning continues. So I thought I'd give a bit of a how-to for the PHRC. So first things first, get a template, which I'm aware is a lot simpler than it is in reality. But for, I guess, my reflection, having sort of helped design the OT version, is that it's not about reinventing the wheel. I do a lot from the medicine and the physiotherapy template, because the medicine one, it's the most tried and tested. It's been sort of around the longest, and it's been sort of the most rigorously sort of gone over. And the physiotherapy one was sort of the only AHP one there. So I kind of drew from some of the things and some of the changes that they had sort of discussed in theirs, and kind of learnt from that. But also it was really helpful speaking to other OTs, other OT educators and students, and then kind of making it specific to that discipline. Secondly, get a team. It's been my observation that everyone that I've discussed sort of this project with has had a pretty positive experience, whether it's been someone at my university or a clinician I've met on placement or just someone else I know in my own life who works in healthcare. I think there's a real interest in sustainability, but kind of like I sort of touched on in my in the sort of the survey that RCOT did at the start, there's often a lack of ability or a clear idea of what this looks like in practice. So I think people are keen on having more sort of tried and tested ways of bringing this into the mainstream. So yeah, from just sort of talking to people, talking to educators, the OT Society, just sort of using those different avenues to kind of amplify this project, and I think people are interested in. So that was sort of nice to see. Thirdly, get support. I think a common question that I got asked is sort of how to balance this project with other academic sort of commitments and personal commitments. So I think it's important to sort of be able to maintain your own sort of enthusiasm and drive for this project while having lots of other things to balance it with. And I think a really key way of doing that is having a supportive team that you're working with. Also, the PHRC has a leadership team, and so each discipline will have a leader, but also sort of particular regions will have a leader, and so they're people who are very knowledgeable, and I definitely sort of turned to them to sort of get support and input, and they've done this for a few years, and so that was really helpful to have their input in that. And fourth, get to work, which sounds a bit blunt, but I think sometimes if you've never done something like this before, it's a bit like a university essay. Like, it seems a lot scarier before you're actually doing it, but once you kind of dive into it, start putting words on a page, it starts to make a lot more sense. It gets a bit less mysterious and a bit less scary. So I encourage you just to get stuck in. And fifth and finally, get promoting. Kind of like I touched on the sort of get a team section, people are really interested to hear about this and to hear about sustainability and kind of what's going on in there for healthcare generally. So just be open to having conversations and sort of seeing where it leads. And finally, I'll sort of wrap up my bit by just having this slide here. So going forwards, I hope I've sort of demonstrated that an interest absolutely does exist in planetary health, but there's still kind of not much of a roadmap for what this looks like for AHPs and in clinical practice, because we don't have necessarily that sort of education in our training. But I think the PHRC, well, it asks quite a lot of in-depth questions. Because they're in-depth, they can give really sort of specialist sort of suggestions and ideas going forwards, and that can hopefully build a culture of teaching these knowledge and these skills. Secondly, I think AHPs are a really sort of untapped sort of powerhouse in terms of what this could mean for sustainability. There's a lot of us and we're well placed, but it's just about giving us the skills to sort of make the most of those opportunities, which I hope with more planetary health education that could become more of a thing. And then finally, I kind of wanted to impress that while I've mainly been talking about sort of university education, education definitely continues beyond the classroom, sort of the formal training that we might have. So I'm sort of excited to see if the Planetary Health Report Card can sort of grow and evolve and maybe think about what planetary health educational opportunities there are beyond formal training. So yeah, thank you so much for listening. I'll hand over to Ka Yan now.
Hi everyone, can I just confirm you can hear me? Great, okay. So hi everyone again, I'm Ka Yan Hess. I'm a OT lecturer from the university down in Oxford at Oxford Brookes University. I've also got a recent new dual identity of actually being a PhD student as well. So I want to take this opportunity to share my story with you, and because I believe that will help actually show in relation to my perspective as a educator. And I would say my story started back in 2022. I had a group of students doing their MSc dissertation, went out to survey fellow AHP students in the UK about their views on climate change, as well as what they've been learning at university, what do they want to learn more about this topic at university. So we actually saw quite a similar picture that Catherine pointed out in relation to our COT survey on sustainability for clinicians. Similarly, from my own survey with my students, we saw 83.5% that said they are concerned and they are trying to take actions in their personal life. However, same thing as well for students, 1 in 2 don't actually feel ready or prepared to do so as a future AHP professional. When we looked a little bit deeper into the qualitative response on what would you like to learn about this topic, one answer that was repeated again and again that really struck me, which was, just give us anything, please, on this topic. So for me as an educator looking at that kind of data, it was really a call for action. I wanted to find tools to capture more of the student voice, to share it with other AHP educators, because I think we can use that to help us plan curriculum in a way that students have had a say, and ideally, where possible, help to co-design some of the curriculum that they actually do at university with us. And it's through that searching I also came across the Planetary Health Report Card, but I was frustrated initially that there was no OT version that I could print off, invite some students to come and help evaluate how my program was doing with it. So I was only very glad when later on I was connected up with Catherine, our main presenter here at the session, by the organization themselves, as a student who's interested in driving a project to develop an OT version. And what I want to say again is this report card is a student-driven initiative, and that is why although I really wanted to have this version of a report card myself, I felt I couldn't really do this without students. So in relation to what I was involved in was ensuring a multiple perspective was gained by inviting more students to comment, give feedback as we gone through the stages of that initial translation of developing an OT version, which Catherine did subsequently take, piloted, and completed it as a first entry into the OT section on the website for the Planetary card. What I do want to point out, actually, when I was looking, which is about roughly 18 months ago, only physio had 1 entry out of the 14 AHP profession that there is in the UK. So I'm very glad and very pleased to see students here beyond that initial uptake from physiotherapy at a particular university, that there are now more different versions of the Planetary Health Report Card. So the one thing I would say I was very proud of ensuring is to gain representation from the start, from a global South perspective, as we managed to get a student from South Africa to also comment amongst the UK students. This is very important for me from a decolonization of curriculum perspective, but also from a climate justice perspective as well. So I really do hope to see more of this being built in the initial development stage in future other versions of the report card. So I'm going to end my presentation here with 3 messages for all of us. For students, you are our future of our profession. Seize tools like this to really make yourself heard in what you want to learn about the things that are important to you, as well as your future service users. For educators like myself, the 2 words I would say is program revalidation. And I imagine immediately you're thinking, we've got to gain stakeholders' perspective on how we should be doing our curriculum, what should be in it. A tool like this is a real opportunity for us to get students on board, to actually help us evaluate how we are doing. I know some of our profession has sustainability written into the requirements of our pre-reg programs in the education. However, some of us may not yet have that within the requirements of our pre-reg programs. However, my guess is the likelihood, at least internally at your university, there would be requirements related to education for sustainable development, which relate to this. For clinicians as well who are listening, we really need you. We need you to have conversations with our students about what does considering planetary health, environmental sustainability looks like in your practice area, or at least what could it look like as well, so that students can start making sense of this enormous global issue that they are concerned about, but yet unsure how to take actions. I think it's only through working together as student educators and clinicians that we will begin to close that gap of 1 in 2 students or clinicians feeling a little bit unsure about how do we actually take actions professionally. So thank you for listening to me, and I'm going to now hand back over to Jessie to take us into the panel discussion.
Fantastic. Thank you. And Jackie, if we can stop the recording there just before I introduce the panel. I'm sure you'll all agree that was a wonderful session from Catherine and